My name's Julian Goodwin. I work in the Eye Research Centre. Someone I work with, called Pauline Eslott, did some research for the Department of Health. I'm going to talk to Anna Marriott about this study. So what's this study all about?
This was the confidential inquiry into the premature deaths of people with learning disabilities. The Department of Health set up this confidential inquiry to look at why people with learning disabilities sometimes live shorter lives than other people.
How did you do this work?
We looked at what happened to 247 people with learning disabilities before they died. We then compared the deaths of people with learning disabilities with 58 people who did not have learning disabilities.
Why do you look at people without learning difficulties?
This helped us to see if things were different for people with learning disabilities compared to people without learning disabilities.
What did you find out about the people who had died?
On average, men with learning disabilities died 13 years sooner than other men. And on average, women with learning disabilities died 20 years sooner than other women.
What were people dying of?
The most common underlying reason why people with learning disabilities died was problems with their heart.
What does underlying reasons mean?
Well, let me give you an example. Say I have a problem with my heart, and then I get a chest infection and die. The underlying reason for my death would be the problem with my heart.
Okay, I understand that, but you would have died from a chest infection, wouldn't you?
Yes, that's exactly right. The most common immediate cause of death for people with learning disabilities was a chest infection.
What else did you find?
The confidential inquiry found that some of the deaths were premature deaths.
What does that mean, Anna?
This means that someone died at a younger age than they should have done, and they could have lived for longer.
Why do people with learning difficulties die earlier than other people?
Sometimes people with learning disabilities didn't get treated quickly enough. There were lots of reasons for this.
Like what?
Doctors need to find out what's wrong with someone before they treat them. Sometimes this didn't happen quickly enough. Also, some people with learning disabilities need changes made to services so they can use them as easily as other people. This didn't always happen.
What sort of changes are needed?
Well, someone with learning disabilities might need a longer appointment with their doctor than someone without learning disabilities.
What else?
Some people with learning disabilities have lots of different medical professionals involved in their care, but they didn't always know what each other was doing.
That didn't sound good. What other problems were there?
Sometimes people with learning disabilities needed someone to speak up for them. It was a problem when they didn't have good support like this, or when doctors didn't listen to family or paid carers about what the person needed.
Yes, it's important to have the right support.
Also, there were lots of problems with planning the healthcare and support that people needed. Sometimes things got to a crisis point before anything was done.
Anything else?
Professionals did not always follow the Mental Capacity Act.
What's that?
The Mental Capacity Act is a law about decision making. If people can't make their own decisions, this law should be used to help them.
Did you find anything that was being done well?
Yes, of course we did. We found lots of examples of good care for people. So, for example, some people with learning disabilities went into hospital before they had an appointment. This meant they knew what to expect when they were going in. Other people, when they were staying in hospital, were allowed to have their carers with them all the time, so they got the support they needed.
So what needs to be done now?
Well, firstly, we need to record in their medical records if a person has learning disabilities.
How would that help?
Well, if services know if a person has learning disabilities, then they can make changes to help meet that individual's needs. This will mean that people with learning disabilities are able to get the same quality as care as anybody else.
That would be good. What else?
Some people with learning disabilities have lots of different medical professionals involved in their care. One of these people needs to take the lead in this. Also, for people with learning disabilities that have lots of different medical problems, it's important that there's good information about this and the support that they need. This information needs to be kept up to date and kept in the same place.
That could work. There's lots of technology that could be used.
Also, it's important that people with learning disabilities get the same investigations and treatment that other people get. If people with learning disabilities have difficulty getting treatment or investigations, then the Community Learning Disability team should be asked to help with this.
You said there were problems with the Mental Capacity Act. What could be done about this?
There should be special advisors who know a lot about the Mental Capacity Act. They can help make sure that people follow the law.
Anything else?
There's a need for good long-term health planning that looks at the whole person. So, for example, if I have a heart problem and epilepsy, the doctor treating my heart problem needs to be thinking about my epilepsy as well.
So Anna, do we need to keep looking at this more?
Yes, we need a system that records the deaths of all people with learning disabilities. This will help us find out more about the reasons why people with learning disabilities die. This information can then be used to help people with learning disabilities live longer, healthier lives.
Thanks for telling us about this. It's really important. And if you want to know more, there's an easy read report that's on the website and we can send it to you.